Hi, I'm Dr. Jennifer Hazel, Jen, which is a lot more comfortable for me. Thank you for coming to this talk. I know that there is some fierce competition on right now, so I really appreciate you being here. But also, it's the last talk of the day. It's the first day, or the second day if you went to Unite, of a really big week. And it's really important that people take some time out to think about this sort of stuff, even when it doesn't feel like it's the most important thing to be prioritising during an enormous event such as Melbourne Games Week. Full disclosure, I got up, I would say, so it was 3:45 in New Zealand in the morning, which would be 1:45 here. I've been awake ever since. I thought this talk was tomorrow. So I was going to chill out in the hotel, have a nap, and then come well rested tomorrow. So if I sound delirious, it's because I am. And as everybody always does at these talks, everyone's always really engaged, really wonderful to me. I don't know whether it's just because, you know, the accent and the stuttering, but everyone's always really cool. So just extend a little bit of extra you know, of your attention and everything today, because I don't know where I am. Also, it is my year anniversary of doing a talk at Unite last year, so obviously a year and a day, when I injured my hip by leaning on the podium for the entire hour. That doesn't sound possible, but I hit 30, and apparently 29, I can do whatever I want. 30, lean on a podium for 60 minutes. It still hurts to this day. I have something called bursitis, which is the big squishy cushiony pad in your hip, is inflamed. It comes and goes, but it's come, which, you know, of course it would. And again, another reason for me to be not quite tip-top. And all of that is relevant. I will tell you why soon. So what we're going to talk about during this 50-minute-ish lecture talk is the CheckPoint AAA model of mental health for game development. This is also a model that you can use anywhere in your life. I'm seeing some familiar faces, which is lovely and feeling very supportive for me. Anyone that kind of follows me or follows the work that we do at CheckPoint has heard me talk about this model to the death. I really do scream about it, and that's because I think it's really important and I think it works. It's got evidence-based techniques within it. It's really quick, easy to implement, and it's something that anyone can utilize at any point in their day, whether they've got 5 minutes spare, 30 seconds, or they want to take a really good period of time for some self-reflection and action. Whatever it is that you've got, you can use this. So that's why I go on about it all the time. Each time I do these talks, they're designed as a standalone installment, I guess, into the greater series that is mental health. So each one, I try and write it so that you'll be able to see it, take away what is important from this talk and utilize that. And then afterwards, if you, sorry, could you shut the, oh, okay, cool. Afterwards, you could go and look at the other talks and get a little bit more information. So if there's something that's not in this one that you thought was really important, please do check out the other times that we've done this. I did this talk, well, not this talk, but a talk about the AAA model at GCAP 2 years ago, which is on YouTube for anybody to see. So please go ahead and catch up, get some extra information. As I say, it's a standalone talk, but it's not meant to be kind of used just in isolation. This is a huge discussion that involves all sorts of different facets. In this talk, I saw the theme of GCAP this year, the walls that we've built, and it really, really hit me. I knew that I had to do a mental health talk because it was instant. I could see the connections between the walls that we build within us and the walls that we build within the industry. And obviously, you know, everybody looks at a kind of metaphorical phrase like that differently. And for me, I just saw that and I was like, okay, cool, inner walls. I don't want to talk about the walls we've built, you know, like building a game wall, or I don't know, there's a script here for the God of War level design talk, so if you want me to go through that, I've got the whole thing. But not really my area of expertise. We're going to talk, and I will be dragging this analogy out as far as I can. We're going to talk about the walls that we build inside of ourselves. We're going to start with development of the infant and talk about how we actually learn to interact with our world, how we build the walls that we find ourselves with as an adult. When a baby is born, it takes about 2 weeks for it to even recognize its parents from any other human. It's just a ball that cries, and as a non-parent, I can say that flippantly. I'm sure the parents in the room will be like, yes, yes it is. And we build our relationships with others through those very early interactions that we have. And those interactions and those interpersonal relationships shape who we become. So I think it's really important to go back to that kind of really day dot and talk about development if we're going to talk about the walls that we've built for ourselves. We'll then go into the subconscious and how we function on a day-to-day basis, and what is it in our minds that's happening actively and below the surface that we're not really aware of, that dictates how we respond to factors in our environment, that ultimately kind of dictates who we are and how we feel and how well we are. And we'll come more to the surface to talk about thought patterns, how these mold the way that we perceive the reality around us, and how you can actually manipulate that for your own benefit. Here's a wall. Told you I'm really going to milk it. So, I said we're going to start with development, and I really am. This is the theory of psychosocial development by a guy called Erik Erikson, which is such a cool name. Erik Erikson, man, that's great. And it's a descriptive rather than kind of causal or analytical model. And basically what Erik Erikson said was that as we age, we go through psychosocial crises. And what psychosocial means is psychological, so the inside world and how we are existing within our brains, and the social, so how we're perceiving the people around us, the world around us. There's a conflict between those two. The conflict changes as we grow. And if at any one of these stages something goes wrong, or something not necessarily even wrong, something just doesn't happen optimally, we can get stuck. If it happens optimally, we develop in a healthy, normal way. I mean, I personally don't agree that normal exists, but that's what old Erik Erikson said. And as you go through each stage, you develop a basic virtue. Again, some of these, this was like 100 years ago, but what I like about it is we can kind of look at where we are in these roles, and I'll go through them a little bit now. So 0 to 18 months, basically the only experience we have is the one that we have with our primary caregiver, which is often the mother, but it could be any individual who's the primary giver of care. And through that person, you learn to trust or mistrust the world. So if you're a baby, as we all were, every single person in this room, well, some. When you're a baby, the world is terrifying. Everything is just raw emotions. And there's no way of knowing what's safe and what isn't. The only way that you can find out is via your primary caregiver. That's the role of the mother, to introduce to the baby if the world is a safe place or an unsafe place. And that's how a baby goes through this psychosocial crisis of trust versus mistrust. So if mum is able to, or the primary caregiver, sorry, is able to teach the baby, well, there are some scary things in the world. I'm sorry that you're crying. You must be uncomfortable. You must have, have a dirty nappy, or you must be hungry. that's okay. Here's the solution to that. The baby learns to trust that, yes, there is pain in the world, but I can get through it. And that's obviously a really important formative part of development. The second stage, which is the autonomy versus shame thing, is about trying and failing. So when you get to about 1.5 to 3, you're able to kind of toddle around, start talking, start interacting with the world, start trying stuff out. And they will. Toddlers will try out everything. And as they're doing that, they will try and they will fail repeatedly until they eventually get it or don't get it. And it's the way that, again, the primary caregiver responds to that. The primary caregiver is able to say, oh, hey, you gave that a go. And, you didn't manage to put that block in the hole this time, but give it another go. And, maybe you'll get it. And they give positive feedback. The child learns, well, I can be autonomous. I can do this independently. And I'm able to do that. But if there's an excess amount of criticism or the parent is overly controlling, then the baby thinks, or maybe I can't do this, or I should say the toddler. So if the mum, is like, no, don't go over there, don't do that, then the world still seems unsafe and the toddler doesn't learn that they can do anything. Initiative versus guilt is about social experiences with others. So if you're able to have a healthy social interaction with peers, you will learn that you're wanted and loved and not a nuisance to others. And then as you kind of go through these levels, as adults, as adults that aren't psychologically trained, you can kind of reflect on them and be like, oh yeah, no, I get that. So industry versus inferiority is academic achievement or some form of competency and achievement at school. And then going through identity and role confusion as a teenager, trying lots of things out. And when it says fidelity there, it doesn't mean like monogamy. It means, are you able to give part of yourself to other people? And as you get older, the kind of goals and the psychosocial crises that you endure and the basic virtues that you learn from them, what you get out of them, change. But if something happened when you were in one of those early stages and you got stuck, how is that affecting your day-to-day interactions now? If you, for example, had a problem at ages 3 to 5 when you were at nursery school, you got rejected or bullied, do you now have a problem with interacting with others because you've got low self-esteem? You think you're not worth other people's attention, other people's friendship. These sorts of things really stick with you, and they stick with you right down in a really deep part of the brain that you only really can confront if you actively look at it and go, oh, no, that maybe that is what's happened to me. So when I crack on about this analogy of walls, these are the walls that you build at every part of your development. This is the walls that you build of, well, if I need to mistrust the world, then you've got an 18-month-old baby who's like, okay, my walls are huge, I can't trust anything, the world isn't safe. I'm never going to try anything. People are scary and they're not going to look after me. No one is going to help me. And then you get a really chaotic, disorganized adult who's not really able to function. And you can see how that would kind of create a knock-on effect to everything else in their life. And I know that's like really like super psychobabble deep and might seem very irrelevant, but I am going somewhere with it. And I just think it's really interesting to think about how those really early experiences can interact with, or not interact with, but how they can shape the way that you perceive the world as an adult, even if it doesn't feel like it. So this is a slide on defense mechanisms, which is the subconscious ways that we deal with threats in the world. And that's, I put defense stats into Google, and I think that's a Pokemon. I don't know. But look at him, he's like, oh, it's Steelix? You guys are cool. So these were described by Anna Freud, not her dad, Sigmund Freud, the weird one. And as you go through those stages that Erik Erikson described, you pick up these kind of defenses, these walls, if you were. And they range from immature and primitive to mature and adaptive. And I've kind of put them along this scale. That was just kind of me today being like, oh God, I've got to give this talk in 8 hours. This needs to make sense. Sometimes psychologists divide them into 4 columns, so immature, neurotic, intellectual, and mature. Sometimes they just divide them into 2. It depends what kind of theory you're with. But these are really important because these are things that we do at a subconscious level, as in you are not aware that you are doing it every day with every interaction. So some might say, if I was going to a psychotherapist, some might say that I did know that my talk was tomorrow, somewhere, but I was quite anxious about giving it, or I didn't feel like I had the capacity to write it yet, and so I hid that part of knowledge from myself, that it was today and not tomorrow. I hid it away so that I didn't have to actually deal with it. Now, I'm an intellectual adult, and I can look at that and be like, no, I would have known, but I also know my flaws. I also know that sometimes I can be a bit absent-minded, particularly if my anxiety is quite high. Denial is a very primitive defense mechanism where you just cannot consciously access knowledge that you should have. It's not that you're hiding it, and it's not on purpose. You literally can't access it. So the traditional example of that is if you lose a loved one, no, they're not dead. No, they're alive. And you're not pretending like you actually believe that. Your brain is protecting you from what it can't deal with. Projection is an interesting one. I see it a lot in the games industry, but also just out and about in real life. Projection is the act of telling someone else that they're doing something that you're actually doing, but you can't tolerate that you're doing it. So it doesn't fit with who you see yourself as a person. So the classic example is the couple that are fighting, and one of them sees himself as very calm and in control. Stop shouting, you're always shouting at me! Clearly that's the person that's angry. And the other person might be very calm, but projection is seeing the undesirable part of yourself in the other person. And again, they're not pretending. They really think that the other person is angry, but it's a part of themselves that they're so deeply uncomfortable with that they can't actually see it. I do it all the time. And, you know, I literally think about this stuff for a living. So it's really important to start actually kind of being insightful about which of these you're using. And I won't go into all of them in so much detail, but I think it's really important to kind of just put a name to them. Acting out is literally what it says on the tin. It's if you are feeling an emotion, strongly acting it, or doing something that represents that emotion. Reaction formation is literally the opposite of that. And I wrote a really long article about Joel from The Last of Us, which I'm sure many of you have played. He does this really classically. Reaction formation is doing the literal opposite of what you say. So, for example, of what you feel. So, for example, if your teenager comes home very late and they said they would be home at a certain time and you're really, really worried about them, when they come back, shouting at them, when actually you are anxious and nervous, but you're projecting that onto them as anger, because that's more acceptable to you than admitting that you were really, really worried and having to face that really difficult, awful distress of being that nervous. Regression is one that lots of people know about. It's actually really, really striking when you see it. It's a very primitive defense mechanism where people will revert to an early state. Again, this is one that I know that I do, because when I'm feeling very upset, I ask my boyfriend to pat me on the head, because it makes me feel like, good girl. And some people do that without knowing. So they'll, like I had a patient who literally reverted to the point of being like a child, and she didn't know that she was an adult. So they're very, very primitive defense mechanisms. And as you move up, you go through things that are more mature, more developed, and more adaptive. And when I say adaptive, I mean they are helping you to become efficient. They're helping you to achieve what you want to achieve. And when you see something or when you encounter a situation in life that's difficult for you to process, they're the ones that are going to help you get through it and there not be negative consequences. Repression is just, I'll just bury that and won't even remember that it happened. Displacement is interesting. Displacement I always describe as kick the cat syndrome. So the boss shouts at the employee comes home and shouts at his missus or partner, the missus goes and kicks the cat. It's basically shit rolls downhill. I recently got 2 cats, and one of them does this. And it's actually hilarious because we looked at them and we were like, oh my God, she has kicked the cat syndrome. So my cat, if it sees another cat that's bigger than it, obviously she'll get very nervous. So she goes and hits the other one, like our other little innocent kitty. She just goes up to it and nowhere, bam. Because she can't process that she's scared of this other cat. So she feels really inferior and she has to act out to be dominant. She has to displace her feelings of anxiety, of inferiority, onto another being to cope with them. And again, we all do this to various extents. Hopefully you don't do it like my cat does. Hopefully you're not going like, poof. But these are things that we kind of do very subtly, and we've all had that conversation. Why are you being like this? Oh, I've just stressed out. Undoing is literally being like, oh, I did something really bad, so I'm going to do the complete opposite to make up for it. Oh, I was really, really poorly behaved, so I'm going to buy flowers and chocolate and jewelry and blah, 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 blah. Which, of course, doesn't actually right the behavior that was wrong. It's undoing, so that's why it's kind of in the middle there. Told you I was tired. Intellectualization and rationalization are 2 different things. Intellectualization is thinking about your problems, and I imagine that a lot of people in this room do this one, in such basic, logical, literal terms that it removes any emotion from them whatsoever. Now, that's pretty good in the short term, which is why it's up there towards the mature adaptive defense mechanisms. But if you continually do that chronically, you never actually deal with those emotions. And rationalization is if you've behaved poorly and you can't actually tolerate that, it's saying to yourself, well, I did it because X, Y, and Z. Even if that's not really the case, if it kind of feels justified to have done it because of that reason, that's rationalization. And then the mature adaptive defenses are the ones that we want to aim for. They're the ones that are productive. They're the ones that are going to help us to tackle life's problems. Sublimation is replacing one negative experience or emotion with another that's more positive. So, for example, if you're having a particularly stressful time, maybe going and doing some charity work is the classic one, but you can really break that down to a very, very basic level. Compensation is like undoing, but in a productive way. So again, if you're feeling terrible, you might compensate for it by doing something for yourself that's nice, like radical self-care. Suppression is it's not repression. Repression is, I'm going to put this to the back of my mind and not actually remember that it's ever happened. It's gone. It's not accessible to me whatsoever. Whereas suppression is, okay, I will deal with that later. I will not have the very strong emotions associated with it right now. I'm going to just pack it down, know it's there, carry on, and I will process that at another time. Humour's my favourite one. Could you tell? And now we're coming up to a more superficial part of the walls that we build, which is our thinking styles. And as I say, your thinking style kind of dictates... I wish the straw wasn't coming out. That was an example of a thinking style. That was an example of... it's kind of like catastrophizing. It's like it's really not a problem that this draw is coming out. I just wish it wasn't happening. Thinking styles, they pattern the way that we perceive everything in our environment. When any event occurs to you, you will respond to it with a sentence in your head. And that can range from something that's really quite damaging. So, for example, this draw keeps coming out and hitting me, so this talk must be terrible, and everyone will think it's absolutely atrocious and hate me, and they'll never talk to me again, and that'll be it, and I'll have to go and move to an island and eat crabs. Actually, that sounds pretty good. That's also an example of fortune telling, as in this terrible thing's happening or this bad thing is happening, therefore it will always happen, or therefore if this draw keeps coming out like it is and hitting me, then everything that I say is just going to be rubbish. And I'm over talking already, but I'm not going to go through all of these. But we've got some really good resources on CheckPoint for actually, we call these automatic negative thoughts, these ones on the left in the red, and they've all got labels and names. And when we call them automatic negative thoughts, is it an anagram of that? Not anagram, acronym for that is ANTS. So we label the ants because they're insects and blah, 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 CBT stuff. And you can literally write down the thought that you had, label it, and then change it to a different one. And once you realize that you can do that and you have the power to do that, it is so empowering, and it's a really, really cool way of dealing with the world. And you can push your thoughts onto the more positive side of the scale up here in green, where instead of he should do this, I must always be the best, I can't ever do anything right, I always screw up, I'm never there on time, you're thinking, well, you know, it's obviously not ideal to do a talk on 2 hours sleep, but you know what you're on about. You know, you talk about this stuff every day, and you know, you're a pretty decent speaker. Other people have said that in the past, so I reckon that you can forgive yourself for that and crack on and do the best you can. You can see how that first thought, oh, well, how can you do a talk on no sleep? You're always screwing up. It's going to make you very emotional. It's going to make you anxious. It's going to make you not be able to think clearly because you're just beating yourself up and there's all of this emotional arousal. But those second thought patterns of just being kind to yourself, actually you're clearing the way to function. And once you're able to kind of turn those red ones into green ones, it's a really powerful experience. So, the wall. Everyone's wall, and the other way I describe this is everyone's coping toolbox, is full of different types of these things that I've just described. You've got some positive, some negative, or some positive ones that you're using negatively and some negative ones that you're using positively. And it's a unique combination, it's a unique structure to you, one that helps you through every day, every challenge that you face, whether it's deciding what you're going to have for breakfast or writing a talk 8 hours before you give it. Every day, you're using these various defenses, these various thought patterns, these various coping skills to tackle everything. And what I'd like to encourage is for us to deconstruct this wall and take out the negative bits and rebuild it with the positive ones so that ultimately all of your bricks are green. I really am stretching that analogy, aren't I? How over it are you at this point? The next part of our process, the AAA model, which is analyse, accept, act, is accepting. So we've looked at ourselves, we've looked at our thought patterns, we've looked at our development from day dot, we've looked at our subconscious defenses, and we thought, well, what is going on in there? How do I interact with the world? How do I get from A to B? How do I tackle life's challenges? Oh, some of those things that I do are actually probably not that helpful. Maybe they're holding me back, or oh, maybe that's why I've got pretty low self-esteem, and maybe that low self-esteem is actually hindering this progress that I'm making. And you've sat back and you've analysed that. The next step, don't do anything about it, just accept it. And for this, we use a very old traditional Buddhist practice called mindfulness, which is kind of having its resurgence at the moment. It's actually a really powerful evidence-based tool where you are able to use the 3 pillars of mindfulness at any given time. So those pillars are, it has to be on purpose, it has to be in the present moment, and it has to be non-judgmental. And that doesn't mean that you have to do a 10-minute mindful meditation exercise. You can do it at any point, at any time, for as long as you need to, as long as you want. It does help to use those meditations. When I first started doing this, I used to set an alarm on my phone when I was at work, when I was a very junior doctor, and I was 23, and I was working 90 hours a week. But I wasn't making Red Dead Redemption 2, so don't worry about it. I used to set an alarm on my phone to go off once an hour, and it would just vibrate in my pocket. And initially, I used to be like, oh, I need to go to the toilet. They must have thought I had so many infections or just something wrong with me. I was going constantly. But I used to just go to the toilet for 2 minutes and just do a mindfulness exercise until I was used to it enough that I could just do it where I was. So the alarm would still go off in my pocket once an hour, and I'd just do it where I was, even while I was still having a conversation. And this is now something that I do while I'm with my patients, which is really cool. So I'll be teaching them about mindfulness, doing it at the same time, and they're like, what are you even on about? And I describe to them what's happening to me. So for example, in the present moment, right now, while I'm talking to you, my hip's a little bit sore, because I leant on that podium a year ago. I can feel my feet pressing against the floor. I can feel that I'm a little bit shaky, which always happens when I'm talking. And I'm just aware of the different sensations that are going on in my body. My tummy's a little bit tight. I can kind of feel my breathing's a little bit more laboured than it normally would be. And all of that's happening for me right now. And I'm aware of all of that while I'm talking to you. I'm doing those 2 things at once because I practiced it once an hour, every hour for 7 years. And I'm aware of all of those things, and I'm totally okay with it. It's not optimum, I'd like to be a lawyer or a politician that gets up and they really know, or they really look like they're in control and they don't show any signs of weakness whatsoever, but it's not me. I am who I am. I'm tired. I'm in a little bit of pain, but I'm doing the best I can. So I'm mindfully, at the moment, giving this talk. I didn't have to do a mindfulness meditation exercise to be aware of all those things and to continue giving this talk. I'm not judging myself. I'm not trying to improve. Just aware of it. And being aware of it is half the battle. And that's why we use mindfulness to accept. Now, if I can, what time? Oh, this little screen's gone off. What time is it? Oh, okay, sweet. I'm going to try and do this. But it might not work because the Wi-Fi here is really bad. Has anyone noticed that? I would tether off my phone, but I live in New Zealand now. I don't like it when you use the internet abroad. All right, it's not loading, but you can go to that website. Let me get the thingy back on. bit.ly/CP meditation. This is a guided breathing exercise led by Jennifer Hale, who's the voice of Commander Shepard amongst probably several hundred other things in games. She's amazing, and she very kindly did a specific mindful breathing exercise that I wrote for our mental health series, the CheckPoint series. So please do go and check it out if you have the time, even if you don't have the time, because it's 2.5 minutes and it's a really good 2.5 minutes. Plus, it was such a cool experience. Like, if you can think of me being like, oh, okay, Jennifer Hale's going to do this breathing exercise, and I have to direct her. That's weird. And I gave her the script, and she did it, and she nailed it first time. And she was like, how was that? And I was just like, yeah, that's really good. She's like, is there anything you want me to do again? You just keep doing it. Just for me, like all the time. It's a really good audio track, so please do go and check it out. And it's a really good way of using our accept skills. And we move on to the last part, which is act. So, of course, you've had a look deep inside yourself at your walls. You've analysed what bricks are making it up. You've accepted that, oh, you know, that's my makeup. That's where I am right now. That's me using the tools that I have available to me. And I'm going to try and replace some of those tools with more productive ones. And gradually, we'll replace brick by brick from non-productive or maladaptive or less productive coping skills into more adaptive and more productive ways of being. And so that's why I talked about this, which again was very psychobabbly and very, basic. But actually, if you sit there and you think about the various things that happened to you, and obviously you're not going to know what happened to you between 0 and 18 months unless it was something quite significant, but we all remember like some sort of formative memory, or you can like find out from your parents or your friends, your siblings, what was I like when I was a kid? Was I anxious? Was I scared of the world? And kind of think, well, how has that shaped who I am today? Where am I now in these stages? The vast majority of us will be somewhere in 6 and 7 at the moment. And how am I leading this stage of my life right now? And how is that affecting my well-being on a day-to-day basis? We can act on our emotions. And what I've written this slide for is to go back to that concept of defense mechanisms. So, we had the chart with denial and projection and the immature defenses on the left and then the mature defenses on the right. What you want to do is try and use as many mature ones as you can and minimize the use of immature defense mechanisms. But that's really, really hard, because when you're using them, you're not at your full capacity by definition. You're using them when you're facing something in the world that is overwhelming or stressful or you can't deal with. And so you're using subconscious inbuilt defense mechanisms to cope with them. And so it's all well and good for me to say, well, stop projecting and stop using reaction formation, stop acting out, just use sublimation instead, because you're not going to remember that at the time. You're not going to remember that when you've got 5,000 things to do and someone's asking you to do one more thing. You're not going to remember that when you're having an argument with your partner or when your baby's crying. You're not going to remember. You don't have the tools. So the first step is to use some basic skills from DBT, which is dialectical behavioural therapy. My favourite thing when I start seeing clients is to do chain analyses of emotional events, because they come in and they say, well, look, this happened. And that's all well and good sitting there in the doctor's office and saying, well, this happened to me and this is what I did, and me going, don't do that. Apparently that's not very helpful, I've found. But what we can actually sit down and do is think, well, why was I, or why were you, why was this person vulnerable to this specific stressor? Something that I find very stressful, someone else might not. I'm sure there's many amongst you who would find the thought of being up here petrifying. I'm pretty okay with it, but there's things that I can't touch a spider, for example. really, really can't. I can't stand being in crowds that are very dense. So just out there before today, I wasn't there. I was around the corner. I couldn't take that at all. That's me. That's my vulnerability. And everyone's different. But it's not enough to just have the vulnerability, you also have to have a prompting event. So for example, say I was out there before, and this probably happened, and I'm sure there's maybe someone or two people in this room that this happened. There was heaps of people around, in the middle of a crowd, someone comes up and they're like, oh, hey, Jen, I haven't seen you in a year, and I'm like, I can't be here. Sorry, I'm going in this direction. So I had the vulnerability of hating crowds and then the prompting event of someone that really wanted to talk to me coming up and me having to say, I'm sorry, no, I can't do this right now, but I will do it later. My reaction to that, depending on how well I am, might be, bye. Or it might be, lovely to see you. I'm sorry, this crowd's really overwhelming, isn't it? I want to make time to catch up. Can I grab you after my talk when I'm much less kind of pent up? And everyone would be like, yeah, no, that's fine. And the consequences of that was I either don't see that person again because they think that I don't want to speak to them, or I get to catch up with a good friend. So if you do a chain analysis and you go right back to day dot, you can think about how you respond to each of these situations that stress you out, and why do they stress you out in particular, and you can start kind of breaking that down and thinking, well, where can I intervene? Radical acceptance is a really interesting tool that has kind of revolutionized my life in a way, and I'm sure it would with a lot of people. Radical acceptance is literally exactly what it says on the tin. So it's thinking, what's happening right now might not be fair, it might not be what I want, it might not be just, but it is. And then just moving on, just being like, it is, full stop, continue. And when you're calm, when you've removed the kind of acute stressor, you can start moving from those immature defenses into the mature defenses. And why I've got a big arrow here from calm into these is, these are two ways of getting calm when you're wound up. So the two acronyms? I always get confused, acronyms, not anagrams. They're very similar words. You can tell that I did medicine for like the last 12 years because I don't know anything else anymore. Accept and improve are the two acronyms. And it's just silly, simple ways of remembering, if you're in an acutely stressful event, how to get yourself back down to that calm state so you can move into the mature defense mechanisms, or you can move into better coping skills. So if you're in acute distress, you're feeling very emotional, do activities that make you happy, contribute to society. You can compare yourself, like the traditional one that I don't think works very well, but some of my patients have found very helpful is, well, at least I've got a roof over my head, at least I've got a meal in front of me. So I think that's pretty, like, some people think that works, other people can find that quite invalidating because it makes you feel like, well, yeah, my struggles aren't life or death, but I still have struggles. But you can compare yourself to who you were 10 years ago, for example. And then that kind of takes away that invalidation. It's like, I know that I've got different struggles now than I did 10 years ago. I also know that I'm much better now than I was 10 years ago at certain other things. So you can put things into perspective. I don't have my presenter notes, but emotions is labeling and managing. Push away is literally what it says on the tin. Thoughts is what we discussed on the previous slides, and sensation is kind of self-soothing and using external stimulus to try and get yourself back to a physiological baseline. And improve is another kind of more similar, which it's a similar de-stressing, de-escalation technique, but it's less activity-based and it's more mind-based. So using positive imagery, perhaps if you've got a stressor, imagining the stressor getting in the cloud and floating away, finding meaning in the difficult situation that you're in. Yes, this is, for example, this situation that's happened to me today has been difficult to deal with, but it's also taught me that I can do these talks at very short notice. But also, I know this stuff, and I can kind of just like roll it out, and that's very validating for me, which is lovely. Prayer, obviously, it depends where you sit in the kind of religious thing, but if you're not into religious prayer, you can think of the serenity prayer, which is, dear God, deity, friends, lover, anything, grant me the serenity to accept the things I can't change, the courage to change the things I can, and the wisdom to know the difference. I really like that. I think about that all the time. Relaxation and one-mindedness are self-explanatory. Vacation, good luck. Seriously though, I quit my job 2 years ago and it was the best thing I ever did. I've gone back now, but it was, if you've got the ability to do it, I would highly recommend it. And encouragement is being your own cheerleader, which I don't need because I've got my cheerleaders in the front row. They did a little cheer for me when I came in. But having a cheerleader in your own mind, be like, hey, no, you can do this. You got this, girl. It sounds silly to say it out loud like that, but God, it's powerful to just be your own cheerleader, to just say, hey, no, you're doing good. You got this. And purposefully do that instead of the endless loop of crap that you tell yourself day in, day out about how useless and worthless you are and how you can't do things and how there's not enough time and you're so stressed, and just, no, you're doing a good job. Go you. And you can just feel the tension fall away. It sounds dumb, but try it seriously. It will change your life. To act on thoughts, I'd like to encourage you to go to checkpointorg.com or checkpoint.org.au, depending on, what you fancy. And we've got a guide called the 3-Step Thinking Hack Pack, which teaches you how to analyze your thoughts, how to label those ants, and then how to change them. And whenever I make guides for, the gaming industry, I try to make it as gamey as possible to make it relevant to the audience. So it's probably a little bit cheesy. These are more like consumer-based tools, so they might be a bit, you might not resonate with them as well, but I think that the content in them is really good. It's stuff like this. So this is literally how you analyze your thoughts and how you change them. And this is just CBT, cognitive behavioral therapy. This is all evidence-based, and you can do it yourself. And actually, while we're here, you're all very lucky because you're in Australia, which means that you can get free online CBT. Not many people know this. moodgym.org.au or .com.au, one of them. Google Mood Gym, free CBT for all Australians. Amazing. So CBT is the act of understanding thought patterns, why they occur, the influences they have on your behavior, and how you can change that. So going really back to basics, what happened? How did it make you feel? And feelings are one word: sad, happy, jealous, angry. What thoughts and images were going through your head at the time? They're sentences. So not sad, but he doesn't love me. Not angry, but she's always doing that to hurt me. Those sorts of really powerful, driven sentences that go in on your mind that you just believe straight off. Why would you question it? Your mind told it to you. Your mind lies, by the way. What did your body feel like at the time? Was there another way that you could tell that you were having these automatic negative thoughts? Did your tummy clench up? Did you get a bit of chest tightness? Did you feel your muscles were tense? Was your back sore? And what happened next? And once you break those things down, you can go back and you can swap the thought with something more productive. So instead of, she's always doing this to hurt me, she has vulnerabilities, and perhaps when she was saying that, she was doing her best and she didn't intend to hurt me. I'll try and respond to that in a more productive way. We can learn together, for example. This art was by someone called Synthwave. I just like to, obviously you should always give credit where credit is due. When we're talking about acting and acting effectively, we have to acknowledge how to ask for help. And it's a really powerful skill and one that most adults don't really learn until, you're well into adulthood. And this is a good acronym to remember how to ask for help effectively. It's Dear Man, ironically. Now, when we got into the room, I told you way too much information. I told you that I haven't slept and that I didn't know my talk was today and that my hip is sore. And you would all be like, we don't care, can you teach us some stuff, please? But actually, I was using this. I described what was happening to me. I described my sensations and my dilemma. And I expressed it to you using both verbal and non-verbal communication in a way that was calm, collected, and delivered my message. I'm not at my optimum. I asserted that there was a reason for that. I took responsibility for the things that were my fault, and also for the fact that, sometimes shit happens. And I reinforced that people do find this talk quite rewarding, and that the audience are usually really good to me and very nice, and that hopefully we could get through this together. I was mindful of how I was feeling when I was saying it, and I don't usually say anything like that, but I did it on purpose to reinforce this. And I taught you about being mindful of one's emotions while you're speaking, even while you're talking, how you can be mindful of your body, your emotions, your feelings. Hopefully I appear confident. And I was able to negotiate. I'm not at my optimum, I'm sorry about that. Hopefully together we can get as much out of this as we can. And I was using my interpersonal effectiveness to communicate to you guys how I was feeling, my experiences, to explain that I'm trying my best to provide something for you and to negotiate a middle ground where everybody understood what was going on, and hopefully instead of going out and being like, oh, she was just rambling for hours about her hip, you'll be able to understand why I actually did this and maybe model it in your own communications, and to be able to ask for help. Because I was asking for help. Every interaction that you have with any human is a negotiation. Even if it's, do you want to get a coffee? Every interaction you have is a negotiation of two people's needs, or multiple, more than two. Which, once you think about it like that, means the world is actually quite fraught. You have to negotiate with everybody constantly, all day. Most people's needs, particularly if it's strangers, are just, let's all just be nice to each other, please. Your needs with your colleagues are more complicated because you need them to do stuff to help you do your job, and they need you to do stuff to help them do their job. It's an ongoing negotiation. I try to keep this stuff in mind, but no one's perfect, and I absolutely do not. And I'm sure my partner, who is sitting right there, is thinking, what a load of rubbish. She doesn't do this at all. I try my best. Sometimes I'm terrible at it because I'm also human, and I've got red bricks in that wall as well. I've probably got more than a lot of people. And that's me, I'm human. We can all try to progress to more positive ways of communicating, more positive coping mechanisms. And being able to ask for help effectively is a really good way of doing that. If you don't take a picture of anything else, take a picture of this. There are lots of online self-help tools. I ironically didn't put Mood Gym in there, but Mood Gym. And if self-help isn't working, if you're persistently distressed, if you're having a real mental health issue, sorry, I misspoke. If you're experiencing symptoms that could indicate a severe mental health issue like depression, anxiety, please go and see a professional, obviously. There are crisis lines in Australia. Here are the ones that I have collated. And hopefully, by the end of this talk, this is your wall. It's all green. And obviously, you know as well as I do that that's not possible, but it's something that we can all try and strive for as we move through life. I hope that wasn't too rambly, and I hope that you got something out of it. Thank you so much for coming along. Eh? Go ahead.
Informal networking is a theatre life. Take a class, you get a drink if you wish to drink. Also, need you all out. So, do you have any questions?
Great. Just before you all get up, we have a whole bunch of handouts that have our entire AAA model in them. The analyse, accept, act model for game developers at the front. Feel free to take one. There aren't enough for everybody in this room, so if you want one, come and get one. Otherwise, there will be at checkpointorg.com/GCAP18 as a PDF. Thank you. I'll be just outside.